This recording will go over HIV and AIDS. HIV stands for Human Immunodeficiency Virus. Immunodeficiency is the key word there. That's the problem that this patient is going to be experiencing. Their immune system is not going to be working up to par, putting them at risk for infections, specifically opportunistic infections, with which healthy people normally don't have problems with, as well as cancer. There's 3 different stages for HIV. The first one is stage 1, the acute HIV infection, and the patient might have the same symptoms with any other viral infection. Fever, sore throat, rash, night sweats, chills, headache, muscle aches, sort of generalized viral infection signs and symptoms that resolve. The patient doesn't think much about it and they go about their business. Over time, though, that HIV infection continues to proceed in the body, going from stage 1 to a stage 2. The patient at stage 2 can get on medications and maintain a pretty functional immune system with medications. If the patient does not treat their infection with medications, they'll progress to stage 3, which is AIDS, also known as acquired immunodeficiency syndrome. A patient who has AIDS is always going to be HIV positive, but a patient with HIV might not have AIDS yet. So they might be able to keep their infection in check with medications, and they might not progress to stage 3. So I can have HIV and not be AIDS positive. If I've been diagnosed with AIDS, I indeed am HIV positive as well. To get the diagnosis of AIDS, the patient needs to be 1, HIV positive, 2, have a T cell count of less than 200, or 3, have certain opportunistic infections. And within your textbook, there's a box with examples of opportunistic infections that you'll want to review and be familiar with. The first one listed is candidiasis, which you should already be familiar with. That is a fungal yeast infection commonly found in women who have vaginal yeast infections or in the oral cavity. They might have thrush with a yeast infection of the mouth. A lot of times, so we talked about if I've progressed to the stage of AIDS, stage 3, I might be experiencing opportunistic infection. And for a woman, it might be a yeast infection that they can't clear up and they can't figure out why they keep having it. So sometimes women, when they're on strong antibiotics, are more prone to yeast infections. And maybe this woman's not on any antibiotics and she keeps getting these recurrent yeast infections. That would be considered an opportunistic infection. When HIV enters a T cell, the host cell stops being an active immune system cell, stops doing the job of a normal T cell, which, if you remember, is the helper cell that says, hey, immune system, we got a problem, send me some backup. It quits sending out those alerts and alarms and instead just becomes an HIV virus factory. So instead of having an immune function in the body, an infected T cell is now an HIV virus factory where it just pumps out new virus to go infect other T cells. Gradually, the T cell count falls, and do you remember what we said an AIDS diagnosis would require? A T cell count of less than 200. So gradually that T cell count's going to fall, and the viral number, also known as the viral load, increases. The immune system weakens, and again, the patient can progress to full-blown AIDS. You can review the HIV life cycle. For testing purposes, I'm not going to ask you identify the life cycle. We're just going to simplify it and know that the HIV virus takes over the T cell and turns it from a functioning immune cell into a HIV virus factory. If you do read about the HIV life cycle, it sort of breaks down the different steps that the virus goes through in order to infect the cell and then produce new viruses to go out to infect other cells. HIV disproportionately affects individuals who are Black or African American, Hispanics or Latino of multiple races, and gay, bisexual, or other men who have sex with men. And we'll talk about risky sexual behaviors shortly and why men who have sex with men are affected at a greater proportion than those people who are not men having sex with men. Also worth noting, the number of new HIV infections among transgender adults persists, particularly in the male to female individuals. HIV is transmitted 3 ways: through blood, semen, and vaginal secretions. I sort of lump those together, as well as breast milk. So although it's possible that some saliva or some other bodily secretions might have some HIV viruses present in them, they're only going to be in the concentration high enough to spread the infection in blood, semen and vaginal secretions, and breast milk. So those are the 3 ways that HIV will be spread. The textbook breaks it down to sexually: genital, anal, or oral sexual contact with exposure of mucous membranes to infected semen or vaginal secretions. Parenterally, which would be the sharing of needles or equipment contaminated with infected blood or blood products. And also perinatally, from the placenta, from contact with maternal blood and body fluids during birth, or through breast milk from an infected mother that has passed on to the child through breastfeeding. It is important to remind our patients and the public that HIV is not transmitted by casual contact. You can't get it from sharing household utensils, towels, or linens, any toilet facilities. It's not spread by mosquitoes or other insects at all. Abstinence is the only absolute method for preventing infection, although mutually monogamous sex with a non-infected partner is also considered an absolute method of preventing infection, assuming that both partners are monogamous. The virus concentrates in blood, semen, and vaginal secretions, and risk differs by sex acts, and the viral load of the infected partner. So there's a reason earlier I said men-to-men sex acts is a riskier type of sex act, and it's just related to anal intercourse, basically, is riskier than vaginal intercourse. So anal intercourse, whether it's a man-to-man sexual act or anal intercourse between a man and a woman, is going to be a risky type of sexual intercourse because the trauma that happens to that anal mucous membrane creates little openings where that infected semen could enter the recipient. Okay, so of the different sexual acts, anal sex is the riskiest. And for patient teaching regarding safe sex, the big takeaway would be barriers, like latex barriers, and lubricant. So a condom, a latex barrier for oral sex, like a dental dam, latex gloves, and a water-based lubricant would all be considered necessities for safe sex. PrEP stands for pre-exposure prophylaxis, and it's a preventative method in which antiretroviral drugs, which is a term used for HIV medications, HIV and AIDS medications, antiviral drugs are taken by someone who is HIV negative and at high risk of exposure to the virus. So it could be somebody who has a risky lifestyle that puts them at increased risk for contracting the HIV virus. It could be someone who's in a long-term committed relationship, but their partner is HIV positive. So in addition to practicing safe sex habits, they also take PrEP medications to decrease the likelihood of them contracting HIV or AIDS. People who have had a positive HIV test at any time cannot donate blood. People, regardless of HIV status, who have injected anything not prescribed by a healthcare provider in the last 3 months, are a male who has had sex with another male in the last 3 months, a person who has taken money, drugs, or other payment for sex in the last 3 months, or a person who has had sexual contact with anyone who is engaged in any of the other previously stated activities in the last 3 months cannot give blood. And those guidelines are trying to decrease the likelihood of someone who is HIV positive donating blood. All donated blood in North America is screened for the HIV antibody. Again, pre-exposure prophylaxis or PrEP is used in an HIV negative patient who is at increased risk for HIV infection. And they take their antiretroviral drugs before sexual activity or drug injection to avoid infection. It's important to remember that patients who are receiving PrEP, the medications do not replace safe sex practices. And so in terms of patient teaching, we have to remind our patients that in addition to being compliant with their PrEP medications, they need to practice safe sex. Post-exposure prophylaxis is also known as PEP, and like it says, it's considered emergency treatment used after potential exposure to HIV. It's not recommended for frequent use. It's for patients or people who have unexpected potential exposures, and it could be through unprotected sexual acts. It could be through sharps, needle sticks. In terms of an occupational hazard, something that nurses need to worry about. I know there was a situation at a place where I worked once where they were having a difficult time getting a chest port accessed, and the nurse had actually bent the needle, but wasn't able to get good blood return, so they took the needle out, but the safety couldn't engage over the bent needle, and she set it down on the bedside table. Another nurse had come in to assist, and she went to grab that device, which she assumed had, the protective cover over the needle, and it didn't. And then she got a needle stick from that. So it's important to be mindful of our sharps when we're at work and make sure that they're going directly into the sharps container, even if the cover is engaged, just to decrease the likelihood of accidental sticks. If you did get an accidental stick at work, you'd want to wash the area immediately. So unlike normally, if you were to poke yourself, you'd apply pressure and try to get it to stop bleeding. But with a needle stick, some resources even say you want to encourage bleeding to try to flush out any sort of infection that might be just within or around the open area in the skin. And you definitely want to wash the area and then follow your policy, the hospital policy for what you would do next for an accidental needle stick. You are not required to memorize the time frames for PEP, but just know that it needs to be started close to when the needle stick occurred or the potential infection from unprotected sex occurred. Let's see, PEP must be started within 72 hours of possible exposure, and it is taken for 28 days. So those time frames are just as an FYI for you. What I would expect you to know is that it needs to be started early, about the time that potential infection could occur, and you'd want to take it as prescribed. Lastly, treatment as prevention is when a patient who is HIV positive maintains an undetectable viral load because they're compliant with their medications, which greatly reduces the risk of transmitting the virus to an uninfected person. Even if an HIV positive patient has an undetectable viral load, they still want to practice safe sex behaviors with their partner. The best mode for prevention of HIV transmission for healthcare professionals is the consistent use of standard precautions. So I'll tell a story. I had a nursing school friend who tried to start an IV on a patient without any luck. Then the floor nurse went in and was able to start the IV. And when she came out, my nursing school friend said something to the effect of, the patient was Hep C positive. And the nurse gave her an attitude and said, well, that's great. I'm glad you let me know that before I went in there. And it just struck me as odd because we treat all of our patients the same. We use standard precautions for all of our patients. We treat everyone as if they had HIV or Hep C, right? We make sure that we're using those standard precautions to ensure our safety as well as the patient's safety. So just another reminder of the reason for standard precautions and the importance of that, right? Not ripping the finger off of a glove when feeling for a vein to help maintain our safety.